It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our next guest, Dr. Daniel Stroud. He's an occupational medicine physician from the Everett Clinic, Shoreline. Occupational medicine, meaning things like safety in the workplace.
Safety in the workplace, treatment of workplace injuries, and guidance and instruction and help in returning to work and returning to pain-free job duties.
Those are a lot of things to cover, and let's get right to it with Dr. Stroud and Shannon O'Kelly.
Dr. Stroud, welcome to Health Talk. Thanks for joining us. Hey, tell our listeners about your practice. You recently joined the Everett Clinic, and you're in occupational medicine, but I'm sure our listeners are going, what is occupational medicine, and what is your practice like? So give us the day in the life of Dr. Daniel Stroud.
Yeah, so I'm up at the Shoreline and Everett clinics for the Everett Clinic, and we are seeing workplace injuries. So we see all the workplace injuries for anyone who has a problem and gets hurt at work. They'll come in, they'll see one of our walk-in clinic staff, or they'll come directly to our occupational medicine clinic, check in, fill out a lot of L&I paperwork, be roomed and see one of our professionals. So we have a staff of about 8 physicians at the Everett Clinic in Everett, and there's a couple up in Smoky Point, and there's myself in Shoreline. Generally speaking, we see anything. So exposures, lots of trips and falls, crush injuries, you name it. If it happens at work.
If it happens at work, you're going to take care of it.
Yes,
or
sir.
You're happy to take care of it. Tell our listeners, because it's a specialty, occupational medicine, so you have some specific education during your medical school and after medical school, et cetera, et cetera. So tell our listeners what occupational medicine is and your training.
So occupational medicine is taking care of work injuries and work illnesses, and our training specific to that. So I got trained in occupational and environmental medicine at University of Texas, Houston. There's several of those programs throughout the nation. And other physicians have basic training through family medicine because they're also seeing work injuries, internal medicine, urgent care. All those places are well trained for this. And at the Everett Clinic, we're a center of occupational education and health through labor and industry in Washington. And so we have a network of workers, health service coordinators who help deal with these injuries.
Absolutely. I mean, this is good stuff, you folks out there. I mean, an L&I injury or a work injury can be complicated by, 1, the injury itself, 2, by paperwork and the required paperwork, and 3, just returning to maybe that work environment that the injured worker wants to get back to and has to be ready and has to qualify. You know, certain employees or employers, I should say, won't let workers back until they're 100% or there's modified work. It's complicated, isn't it?
Yes, and we're trying to work with employers, work with employees, and find that happy medium so there is some sort of modified duty or light duty available, because that's going to be cheaper for the employee, for the claim, for the employer. It's going to help the employee recover from the illness or the injury quicker based on all the research and studies out there.
And you're going to help when that worker comes in and it is a on-the-job injury, whether it's L&I, which is state-funded labor and industry insurance, or it's self-insured. You're going to help that worker navigate that insurance, opening that claim, getting the claim allowed, getting the treatment, and progressing back to return to work. You probably start that process on the initial evaluation.
Absolutely. And at the Everett Clinic, we train all our physicians to help fill out the report of accident and all the activity prescription forms so that everyone is taking care of the paperwork and the claims management side as well. And then in occupational medicine, we help with any of the snafus or the little issues that can occur.
And there are issues that can come up along this progression of getting back to work. And it's nice to have someone with your experience in occupational medicine to help guide that patient.
Absolutely. There's all these issues with new hazards we might not be aware of, or work modifications that need to occur to actually help a safe return to work when they're still injured.
I know from an IRG standpoint, perspective, physical and occupational therapy that we provide, when a worker shows up for the initial evaluation, we are going to do a modified job analysis and assessment and start really working on functional training and activities to get that. It's almost like an athlete. You're going to assess the needs and return that worker or that patient to that functional activity.
Yeah, and we love using services like yours. Physical therapy is big on helping workers get back that function and reduce that pain and perform their job duties.
We're going to keep talking about safety in the workplace with Dr. Daniel Stroud and Shannon O'Kelly as we continue with this edition of IRG Physical and Hand Therapy's Health Talk. We'll be back with our next segment right after this timeout here on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We continue our conversation on safety in the workplace with Dr. Daniel Stroud and Shannon O'Kelly.
Dr. Stroud, again, thank you for taking time out of your day to come down and join us on Health Talk. We're talking about occupational medicine. You're an occupational medicine physician at the Everett Clinic, assessing and taking care of that injured worker. We talked a little bit about what that looks like and what your training is, but tell our listeners, you do the evaluation, then you're going to recommend treatment. That treatment could be, come in all forms: physical therapy, occupational therapy. It could be work hardening, work conditioning, and even do what's called an FCE or a functional capacity evaluation to get that worker back to activity. Maybe walk us through that continuum of care.
Yeah, so when we have injured workers, there's some employers that are really good about getting them back to work on modified duties, and some employers who don't feel they have anything safe or have any work available with those restrictions. Depending on the situation, we end up trying our best to minimize time loss, maximize function with a safe return to work. And in the event that it's not safe, we like to use physical therapy clinics like yourself for work conditioning programs to get that employee strong enough and the proper health so they can return to whether it's full duty or a modified duty that fits that employer's needs.
Yeah, and during that process, it's all about collaboration with the care team, and that's the physician, that's the therapist, that's even the your vocational counselor if there's someone on board, or the case manager, nurse case manager. It's all about communication. That's important.
Yeah, and at the Everett Clinic, we have the health service coordinators, since we're a center of occupational health and education, that help coordinate and collaborate that communication. The physicians are communicating with the claims managers, the therapists, other physicians who may be helping with the claim, and we're just all having that coordinated, collaborated effort.
During that continuum, as we're coordinating and collaborating, there might be a time where we may have to look at what the capacity is for that worker to get back to activity, and that's where you're going to order like a PCE or an FC, which is a functional capacity evaluation. Maybe talk about that a little bit. Do you do those at the Everett Clinic?
Not yet. We like to use other services for physical capacity exams and functional capacity exams, and that helps because we don't know exactly what the worker can do because we're using our physical therapy notes and the worker's responses to what they're doing at home to produce those modified duties. So to get a more objective work restrictions, we like to use those functional capacity exams.
And those FCEs, just for our listeners out there, those are like 3-hour, test. I mean, it's a very comprehensive. There's a lot of different activity, a lot of different functional sets that you're going to do. It's based on software, and actually what's going to happen at the end of that, you're going to have an assessment of what your tolerance level is or your functional capacity, what you can and can't do. Because that job you're going back to has requirements, and we're trying to get you there or get the patient there.
Yes, and oftentimes we don't even need it. People make recoveries and are back on full duty in a timely fashion.
Yeah, and so there are two different things that sometimes patients are confused about is work conditioning versus work hardening. As we wrap up here, maybe talk about that real quick.
Yeah, work conditioning is really just building that endurance and performing those work tasks that we expect them to do on the job, and work hardening is when they're in a little bit worse situation and need a little bit more help. More extensive.
Work hardening is more extensive. Dr. Stroud, thank you for your information. Thank you for your time. Welcome to Shoreline and the Everett Clinic.
Thank you so much, Shannon.
You've been listening to Dr. Daniel Stroud, occupational medicine physician from the Everett Clinic Shoreline Occupational Medicine. You can get more information at everettclinic.com. Shannon, I would imagine even in a place like your place of business, safety in the workplace is important. You've got people that are doing things, a lot of physical stuff.
Absolutely. I mean, it's all about lifting and body mechanics and understanding your body and using it appropriately. I mean, any workplace can have a potential injury.
All right, we'll be back with our next guest right after this timeout on Como.